I lived in an old stone house. I pulled up water from a well. I had kerosene lamps. I had no electricity. I had no running water. And I lived that way for 17 years. I traveled a lot. You know, I'd come back to New York. I'd go to Morocco. I went to India. Oh, but it was a life where, for instance, you certainly weren't worried about what your teeth looked like. It didn't matter. And also when you're young, and I teach, so I know what young people look like. When you're young, you don't know how beautiful you are. The way I would like my teeth to look now, because as you can see, I'm not somebody who's doing Botox. I'm not doing any of those things. I'm not even particularly trying to look younger. The more concerned I become about my own teeth, the more I'm aware of the rest of the world has wonderful looking teeth. I know I don't look that bad, but I will if I don't do something about it. Another few years, tea drinking, living, and my teeth are going to look that bad.
Pat is very typical of many of our patients. Everybody wants a great smile today, and everybody can have a great smile today in just 2 visits. It doesn't matter whether you want to put veneers on only your top teeth or your top and bottom teeth. It doesn't matter whether you want to do 4 veneers, 6 veneers, or 10 veneers. It still takes just 2 visits, and in between those 2 visits, you wear temporary veneers. So we're going to get started showing you the procedure using Pat as a demonstration, where we're going to do 10 upper veneers and 8 lower veneers, which is pretty typical of what most of our patients want.
I never had to cope with this thing of, oh, I'm losing my beauty, I'm losing my identity. It was never there as part of the identity. Several years ago, when I suddenly looked in the mirror and realized, when I smile, what you see are very old teeth. I don't think doing my teeth is going to change my life, but I'm not looking to change my life. I am looking to maintain an appearance that I think is appropriate in professional life. And yeah, it will make me feel better, much better, because I won't have these teeth that I'm ashamed of. That will be gone. So yeah, it will make me feel much better, really will.
So Pat, today we're going to transform your smile with the use of porcelain veneers. Porcelain replicates enamel, which is what teeth are made of. What that means is that the porcelain is translucent, it's lifelike, and it reflects light. And the beauty of porcelain veneers is that we could create a smile that looked like your smile, will actually look better than your smile when you were young. So when I take a look at your teeth right now, smile for me. That's great. We're going to be able to use porcelain veneers to change the color of your teeth, to align the teeth in a nice formation, and to give better shape to each tooth. And inevitably, it will literally make you look younger because your teeth will look younger. The porcelain veneer is actually glued or bonded directly onto the tooth. In order to make room for the porcelain veneer to be bonded on top of the natural tooth without having it look too bulky, it's necessary for us to reduce the tooth structure by approximately 1 millimeter, which is not a lot of enamel, by the way. Most teeth have 2.5 millimeters of enamel, and we're going to be reducing 1 millimeter of that. In order to reduce the tooth structure, we're going to have to get the patient numb, and then we're going to prepare all 10 teeth on the top arch and 8 teeth on the bottom arch, and that's going to create a whole new smile. It's necessary to measure the length of the teeth so we know what we started with and can figure out what we want to end up with in terms of how long to make the teeth.
So Pat, I'm just going to take some composite, some bonding, and I'm just going to very quickly sculpt it on your teeth just to see what you would look like if we built these front 2 teeth out a little bit more and gave you a little bit more length. This way we could determine how long we want the teeth to be when we actually do it for real with the veneers. Facially. So Pat, what we're doing here, we're taking an impression of the bonding of the new length of your teeth, so that when the ceramist sees that, then he'll know how long to make the permanent teeth. So together we designed how long it should be and how far we were going to build your teeth out in the front, which were set back. And then we send that to the ceramist so that he can use that as a guide towards making your permanent veneers, which you're going to get next time.
All right, Pat. Now we're going to reduce some of the tooth structure to create room for the porcelain. After the teeth are prepared, we're going to take an impression to send to the ceramist so he can create the porcelain veneers.
Now that the teeth have been prepared for the veneers, the next thing we have to do is transfer Pat's smile onto a stationary model so we can line up the smile line with her eyes. And that's what we're going to do right now. We're going to make that transfer. Now we're going to take an impression of the prepared teeth, and that impression is going to be sent to the ceramist to fabricate the veneers.
Okay, glad you got the tray.
Pat, open what?
Open a little. Stay like that. Okay. Wow, they look great. They look great. So Pat, these are just the temporaries, okay? I'm going to show you what they look like, and then in 2 weeks we're going to get the permanent real veneers back, okay?
Okay.
And there's a mirror there for you.
Oh my God.
Isn't that something?
It's amazing. People rarely actually mention your teeth. I had a couple of people who said, you've done something with your teeth. Most people knew I had done something, but they weren't sure what it was. My teeth were getting so dark, and in 5 years they were really going to be they were going to be really ugly. They didn't look clean. They really looked uncared for. So I think I did it at exactly the right time for me. It was worth every minute of it. Also, mine was, I think, more difficult because you really reshaped some very awkward-looking teeth. And the teeth that I have now are interesting, they look like my teeth, but my teeth never quite looked like this. They weren't really quite so pleasing in their shape. I am so glad I did this. It really makes a difference. I really hadn't expected it to mean so much and to matter so much, but it does. There's something about a confidence that it's given me. We talked earlier about, it's not going to change your life, etc., but in a very, very subtle way, it has changed my life.